A very good morning to one and all. This is a e-learning on aggression management and de-escalation technique. I am Jabaseeli Gladies, Professor, HOD, Department of Mental Health Nursing, ES College of Nursing, Villupuram. So, what is aggression? Aggression, it is a common behavioral problem that happens in an emergency setting in a psychiatric department. So, nurses, as we must recognize the early warning signs, and we have to provide a safe, respectful therapeutic care to prevent escalation, and this is a main foremost is to maintain safety. So the goal of this e-learning is to prepare the nurses to safely respond to aggressive behaviors using communication techniques, empathetic understanding and structured intervention, minimize the needs for restraints and cohesive force. So what is aggression? It is nothing but a behavior which causes physical or emotional harm to self and to others or else to other properties. So what are the types of aggression? Based on the type of aggression, the classifications are verbal, physical, self-directed harm to self, or property aggression, instrumental aggression. Verbal aggression using words, that is threatening words or abusive words, yelling at others or insulting. Physical aggression, it is harmful body actions, hitting, kicking, beating. Such activities comes under physical aggression. Self-directed aggression, that is harm causing towards self in the form of self-injury or attempting suicides. And property aggression is destroying objects, breaking all the objects, throwing items. Such things will come under property aggression. Next, instrumental aggression. This type of aggression is used to achieve an objective, keeping a goal in the mind to attain that goal. They will use this type of aggression called instrumental aggression. So what are the causes? The causes of aggressions are many. So it can result from psychiatric disorders such as schizophrenia, mania, substance intoxication, or it may result from frustrations, fear, unmet needs, and any history of trauma, neurological conditions like brain abnormalities or brain injuries, or due to stresses that is found in the environment. So these are some of the causes that can cause aggression. So you have to remember in your mind, aggression is a response to a distress. It is not a personal attack. So we have to be alert to identify the early warning signs. So the stage called pre-assaultive stage. The action takes place. Actually, that is an assaultive stage. Before the assaultive stage, the client or the individual will exhibit some of the early warning signs, where as a nurse or healthcare professionals, we should be alert and avoid escalation of aggression. So some of the indicators we can keep in our mind to understand the warning signs of aggression. So behavioral indicators. So when you see a client or any individual who in the stage of pre-assaultive stage in aggression, they will have their fist will be clenched and they will be restless, they will show anxiety, they will be irritable, they will be staring at you, or they will be shouting loud voices, and they will be restless, that is they will be here and there walking, fear, and they will be frustrated. They will have increased breathing, their muscles tensed, that is they will have contracted their muscle tensions. It will be very kind of contracted stage, and they will be having doubt. So when you go to emotional indicators, they will be very anxious, they will be irritated, fear, frustrated, and there will be suspiciousness. So these are some of the behavioral and emotional indicators you can see. Apart from that, you can also see some of the physical symptoms which are shown in the picture. Feeling hot in the neck and face, jaw clenching, teeth grinding, headache, fast breathing, sweating palms, tight chest, stomachache, shaking and trembling, blood pressure will be increased, feeling hot throughout the body, muscles will be tensed, fist clenching, and rapid heart rate. So early identification is very important, and it is very critical, and it is important to prevent escalation. So what are the de-escalation techniques you can use when the individual is in aggression. So de-escalation is equal to maintaining safety plus reducing agitation plus preventing violence. All these together only constitute the techniques of de-escalation. So keep in your mind these all some of the principles which you follow, automatically the individual or the client will not go into an assaultive stage. So you stay calm and stay composed when handling an aggressive client. You don't use an threatening posture by keeping the hands on the hips and standing. So use a non-threatening, very silent posture. When the client sees you, you should not get stimulated. Allow personal space, 2 arm length space between you and the client. Speak slowly and speak with a simple language that the client can understand. Show empathetic understanding and active listening. Avoid arguing, avoid ordering, or avoid challenging, and avoid explaining the behavior. One staff member should speak, the other staff member should support the client, and they remain supportive in the area, and provide choices and don't order and don't command to do. And very important, you should not explain the behavior to the patient and never touch the patient without consent. So some of the communication skill is very important to handle such an aggressive client. Some things you should do and some things you should not do. Avoid it. So a very empathetic understanding and active listening helps the individual to understand his behavior, and it is a good technique to promote de-escalation. So what are the things you should do? So we have to talk in a way that we are understanding his feelings. So you can say in a way that I want to understand what is upsetting you, rather what you are doing is wrong. So don't always comment on his action. Make the individual to understand that you are understanding his behavior. So offer choices. You listen patiently and allow him to talk, and maintain a neutral facial expression. Don't show any type of emotions or stress or anger in your face. So the facial expression should be neutral, neither stress or nor happy or nor sad or nor fearful. So set a clear and respectful limits with the client. So you should avoid saying patient calm down, calm down, calm down. That again aggravate the patient. So don't force him to take decisions. Don't interrupt in between the communication. Don't stare at him and don't frown your eyebrows, and don't give any threatening consequences. This you are doing, you will face a lot of consequences. Like that you should not threaten him, or you should not shout at him, or you cannot argue with him. You cannot corner the patient. So the patient is aggressive, you should not corner him. That patient is aggressive and you cannot make him to we cannot neglect him, or we cannot corner him in any aspects. Don't challenge him or don't blame him for his behavior. So, and don't show your expressions, shock or fear towards the client. So tone matters. Whenever you talk to him, speak in a soft, gentle tone, a very soft manner, but we have to talk in a confident way. So some of the non-verbal techniques you should follow whenever you are handling such an aggressive client. So when you are handling the aggressive client, the way you stand, the way you nod your head, or the way you give expression plays a very important role. So always you stand in an open manner. That is, your hands, fingers, everything should be open, and it should be in a relaxed body posture. Don't tie your hands, or don't keep your hands on your hip and stand, or else don't tie the hands at the back or the front. So it should be open. The fingers should remain open, hands should be relaxed, and you should sit in a body posture. So the hands should be visible to the client. He should see your hands are open and it should be visible to him. And you should have slow movement when you are handling them. The movements, that steps you are taking when we are going to near them, it should not be so fast and harsh. It should be very slow. No sudden actions that again irritate him and aggravate him. So support eye contact. You keep eye to eye contact, not staring to the individual. So you should immediately keep in mind that when an aggressive client is getting escalated, exit route should be clear. Okay, the door should not be blocked. The exit clear should be the exit route should be clear, so that it is easy to escape. And you should give, already as I said, you should give a personal space, 2 arm length between you and the client. And you should always, whenever the client speaking, nod your head to show that you are listening them and you are understanding them. Some of the environmental manipulation should be done when a client is actually in an aggressive state. So when a client is aggravating or is getting stimulated to aggression, nobody should be there to make a crowd and shout at them or make noise. Crowding, noise, and small stimuli can aggravate him. So reduce the crowding, reduce the noise, and all the sharp objects or dangerous objects, whatever you feel are near to the patient, should be removed for the safety purpose. And this room should be very safe and comfortable. The furnitures should be safe. The furnitures, when a client is very aggressively shouting, immediately he can lift the chair and he can break something, or he can use to throw on somebody. So everything, the furniture should be safe. Totally the room atmosphere in the patient for the patient should be safe. And ensure staff availability, that is adequate number of staff should be available to handle an aggressive client. Ensure clear exit route, no blocking on the way of the exit. Door should not be locked when you are handling the aggressive client. So these are some of the environmental changes you should do for handling aggressive clients. So assaultive stage management, very very important. So during the stages of assaultive, that is excessive aggression, he may go into assaulting others or he may assault himself. So what happens if aggression escalates to violence? Immediately you have to call for help. Maintain safety. 3 things you have to keep in your mind. You should be safe, patient should be safe, and others should be safe. So call for help. Immediately you can vacate all other clients from the room, and you should also keep a 2 arm length distance between you and patient, and exit road should be open for a proper escape. And the patient also should be kept safe. Remove all the sharp objects and all other threatening objects which is not safe for the patient should be removed from the client room. And use team-based physical interventions if necessary, and as prescribed by the psychiatrist, medications can be administered to make a client calm. And apply restraints, that is your physical restraints, as a last resort, and it should be followed with the proper legal and ethical standards. So after crisis, after violence, or after assaulting, what is the therapeutic support? So once the client calms down, you have to offer a comfort and a reassurance, and you should debrief with the patient to understand the triggers. Debriefing is important, sharing the experience, what behavior is showed and why the behavior has developed, everything with the patient, so that the patient can have a self understanding and what is triggered in them and what are the consequences he faced, what happened, everything. If he is understanding, will help to recover by himself and not to repeat in the future, to control all the triggers. And all the event to be documented and reported. And staff also should be taken care frequently. The nurses who are exposed to such a crisis response, they also will be burned out. So they also can have a staff debriefing for their emotional support. So what is the main role of a nurse here? It is our duty to provide a safe and comfortable environment, and for a patient, for us, and for others, and for the proper running of the taking care of the patient. So the nurse plays a very important role in taking care of a client who is in aggressive stage. So the first responsibility of a nurse is to maintain a safe environment. and it is the nurse responsibility to build a therapeutic rapport. A relationship between a nurse and a client plays an important role in avoiding escalating of violence or escalating of aggression. So when we handle such a client, we should be professionally calm, and we should identify the early signs of aggression, and we have to use all these escalating techniques to proceed further to prevent proceeding further to aggression. So use trauma informed respectful approach, advocate for the least restrictive care, and practice self-awareness and emotional control. And nurses should be trained to manage their own stress response. When they are able to manage their own stress response with the help of empathetic understanding, it is very easy for the nurses to understand others' emotions. Thank you. Hope you might have understood this e-learning session. Thank you very much for listening.